I have come to know that racism is here, is in your head. And if you want to perceive it, you feel it. If you don't want to feel it, you will not feel it.
Sure. Sometimes, as you see with the patient with the problem with the legs and the bladder, sometimes they told you something that before never come out.
Yeah.
So sometimes I like this approach because they tell you more.
But I've seen how you are able then to reassure the patient, look, what you have done is enough for your problem at the moment. We need to wait and see what happens in the coming days. I think that that's an approach that I really admired, and if there's anything I've stolen, that one I'm taken. That one I'm taken. And since you're not married, we give you an African girl.
That could be. That's we have to talk about.
We have to talk about.
I have some ideas about.
Okay. Fair enough. Only thing is that you may have. You came in and it's interesting. You're in Italy, but you know something that is happening next door in Uganda, MoxyBion Africa. I didn't know anything about it. So, having seen such a project, and it happening that you also know the people with that project. I don't know. Maybe we can also reach out to them and see. Can we expand this program to also include Kenya, because also Kenya with the cases of HIV, a lot of HIV problem. Maybe this program can also be good for tuberculosis in Kenya. I don't know. We'll see in the future.
Maybe.
Yeah.
Sure.
Yeah.
And I'm sure that I tried to make the students understand that you can use the both discipline together.
Yes.
And they can support each other.
Yes.
So maybe we can support in the same way in the future.
Absolutely. Most important also, you are able to relate very well fascial manipulation and moxibustion, and helping the student understand how, when, why, and in terms of using this strong treatment methods. Thank you.
Yeah, we can also mention the benefits of integrating the manual therapy with moxibustion, and like how it can.
It is not written in the question. Sorry.
I am done. Granted. Let's go ahead.
So, moxibustion, as we have learned from him, is a way of either putting in a little bit more energy in the body, or removing a little bit of excess energy in the body. So once we understand that, then from what he has taught us, and then we understand the manual therapy part, which also is the mechanical part of it, we are able to treat patients mechanically, mechanical, but at the same time be able to use heat to stimulate the autonomic nervous system, or rather the central nervous system, if you like.
Yes, sure.
Yeah.
Because more than putting inside or draining out energy, we are really dialogating with the autonomic nervous system that is more powerful than mechanic sometimes. So if we have a patient that is what nowadays we call a centralized patient, so with more problem of central nervous system than the mechanical real problem, in that kind of patient, manual therapy is limited and is powerful. But if we have a way to dialogate better with the central nervous system, we can have a better result, a better understanding for the patient, and so a better well-being. So combining them together, we can help them more.
Oh, yeah, absolutely.
My turn?
It's your turn, yes.
How did your approaches to moxibustion differ, and how did you find common ground?
That's yours?
Maybe it is both, but
So,
we can't answer in the proper way because you are at the first approaches.
Yes,
maybe.
And you're on the advanced.
Yes, so it's different.
I knew mostly only the basics, only the basic, very, very basic application. But now with his help, I've learned more uses of moxibustion. Him, on the other hand, is coming from different training, Chinese, Japanese, and having also had having a practice that he does this
And,
every day.
we noticed that I also have a little different kind of way to treat also
Yes.
with is more my style now, no?
Yes.
Because putting together many approaches, I changed a little bit. I know I'm not the canonical way of treating, and also my approach to moxibustion, my approach to fascial monotherapy is a little different because I put them together. So when I explain, I always try to explain them in the original term, but then when I have to resonate as a clinical case, I mix a lot, so a different kind of approach.
Mm. What's the future project exactly? What future projects excites you? For me,
It's
is
more yours,
Yes.
because that's really yours.
You can also have a future project here.
Yes, but he has a more bigger project here than me.
So my future exciting project is whereby we can use fascia manipulation, maybe also moxibustion, to treat people in remote places where you cannot find a hospital, you cannot find a specialist medical doctor, you can even not find actually a trained medical doctor. You may find maybe nurses, clinical officers, and such. So for me, being able to take this kind of treatment there where we have no equipments, where we have no facilities, I think this is where this treatment belongs, because in those remote areas where my grandmother in quotes is and needs very strong and effective treatment, yet it needs to be very simple in terms of its application and the tools that are needed. So fascia manipulation, we only need our hand and our brain, and so we'll only add some heat to warm up the body, which is moxibustion. Again, we carry in small boxes. So I think for me this is the biggest project.
Good.
Yeah.
Then you have the project of the school and
Yes,
so on.
yes.
Except my project, I can say that my project started with this trip because I'd like it to be more recognized as a teacher also internationally,
Yes.
because I like teaching, and so this one is the first time I teach abroad.
Oh, excellent.
Maybe it's the start of the project.
Yes, it's the start of the project. Awesome.
How many questions?
How many to go?
Just
Take of some out.
no.
Okay.
What new techniques or ideas are you both eager to explore in your next collaboration? This is similar to the other.
It's a similar,
Yeah.
similar question. This one says, if you had to switch roles for a day, what would you find the most challenging about the other's work?
Repeat the question.
It says, if you had to switch roles for a day, what would you find the most challenging about the other's work?
Good question.
For me, patience. I think you're too patient. I think you're extremely patient.
No comment. I don't answer.
If I'm to say, I think you're really, really, really patient. It's a good vibe. It's a good thing. It's a good thing. I wish I had a quarter of it.
Pass on.
You're passing that one?
Yes. You never told me that I'm obliged to answer.
Granted.
If you could describe each other's teaching style in one word, what would it be and why? Well,
only one
you
teacher.
didn't teach it.
Yeah, so that one is not one opinion. What's the most interesting or unexpected thing you have learned about each other during this collaboration?
What did you?
What's the most interesting or unexpected thing you have learned about each other during this collaboration? Oh, it's easy for me to say what I found for you. That you're not choosy about the food to eat.
I found it really wonderful. Your, as I said before, organization also of the time outside of the course.
Thank you.
So really good choice, really, and be also in a place where traffic is always against us.
Yes.
So good, really good.
And this one says, if you could take one element from the other's practice and incorporate it into your own, what would it be?
Well, I don't like too much, but I'd like to have the knowledge of chiropractic that you have.
Okay.
Also, if I don't like, because I tried and in my experience I passed on,
Yeah.
but I'd like to have the experience and the knowledge that you have in that field. Okay.
Mm-hmm.
Because I like to have knowledge. Also, if I don't use a technique anymore, but I like to have the knowledge of the technique, because it can also be useful. Sometimes in the life, it can be the best thing that you can do. And so I'd like to have your knowledge, that you have a bigger knowledge that I can achieve in that field.
For me, is little is more. I think,
And depends.
yes, if I'm to learn, I have learned little is more, and I have now learned that I need to be always be very attentive when to decide more and when to decide less. In an African setting, we are always used to a lot, and this has really taught me a lot. Like, very little is more. Like, for example, the patient we treated yesterday, this boy who had this chest infection, he only treated 2 points.
Yes.
And this morning he had opened up, although he still needs to take his antibiotics, but he had opened up. He's speaking, he can breathe better. I think that was amazing.
Yeah. Sometimes less is really the
It's
more.
really more, yeah.
You can do. Burn them. Oh, this is a long one. What do you think is the biggest challenge facing the integration of moxibustion into mainstream healthcare, and how can you address it together? Oof. It's a podcast, not an an encyclopedia. Well, the most difficult thing is that usually moxibustion is not considered as scientific, because the studies that have been done on moxibustion are usually the poor quality studies, and so usually they are not considered scientific. In fact, as you saw during my lesson, I didn't use study about moxibustion. I used study about the receptor of the heat in our body, to explain why applying heat in a certain way helps the body to heal, because the study about the receptors are more good quality compared to the others, and this is a way we can understand moxibustion, but this is the most important limit that we can have in spreading it in the African system, because it's not considered scientific.
Yeah, and also the other thing is, like in Africa setup, people have never had it. People have never had of moxibustion. Yes, African setup, people have used heat. Like in the Somali, they use turbine, they use iron or hot iron, but not in the way that we are using it now. So it is my hope that we have planted the first seed.
Yeah.
So let's wait for it to see how it germinates. And this one is mine.
I hope we're not skipping questions.
No. What's the most memorable moment you have shared during this training, and why does it stand out?
The beginning, and I was really anxious about starting, and really anxious about trying to make a sense of all, and try to communicate in a better way. So that moment is the climax for me. So the first hour of the first day.
Actually, it's almost the same. For me, it was the hotel.
Yeah.
I was very, very nervous that you'd like the hotel and you'd be comfortable. And also that, being the only white guy in the whole hotel, that you not feel like, I was giving you the experience I get when I come to Padova. Like you feel, but you also get to feel that actually people don't really care about your color, and people are not racist. It's you who thinks about racism.
Sure.
It is not, sometimes it's not even the other people. I remember the first time I went to Italy, and we're in something called TNA, deep inside of Padova, and I was the only one, and the room I was white, and I was like, man, was it a wrong thing to come here? You understand? but again, I will tell you, I've been held by that family like an egg up to now. So I have come to know that racism is here, it's in your head, and if you want to perceive it, you feel it. If you don't want to feel it, you will not feel it.
Sure.
Will Dr. Luca Pella want to tell us, did you like the hotel?
Yes, I liked the hotel, and the first time, the first night was really, how can I say, funny, because we went there and he was really nervous because they didn't find the booking.
Yes.
But I was really quiet because I thought, well, I'm with him. If I'm not sleeping here, I will sleep somewhere else, and he will help me. So I was really quiet, and no problem.
Yeah.
Stop doing question you.
It was this.
Okay. What has been the most rewarding aspect of working with each other? I think for me is we can talk and agree. We can say, can we do this? And we do it. And even when I ask
it's because we are the same craziness.
Yes. And sometimes I stretch him too much, and I feel it. But I also want him to give us all the knowledge. I don't want him to go back with the knowledge. So some of the time this is why I stretch it.
The first day I came here, that it was not the day of the course, but just to see the clinic. He said to me, during the course we will see just 2 patients. Okay, so that day that was not the course, I saw 4. The first day of the course, almost 4.
Yes.
Second day, also 4. From 2, 12. No. This is slaving.
In the same way.
Where do you see your professional relationship going from here? Anywhere, I think.
Yeah, I think
can be anywhere. Can be maybe next year again. The other year no, but the year next again. Depends on our craziness and what we can do. What our business in the future. We will see. But sure, I think we are open to think about something more.
Oh, yeah.
And we will see if we are on the line in that time.
Absolutely. Whew. The last one. Hey. What's one thing you admire about others' approach to patient care or teaching? Dr. Luca has, how do I say? He has a sneaky way of getting into the patient. What do I mean? He'll always start by introducing himself, and then after introducing himself, he'll tell the patients, I want to know everything about what has happened from you, and after that, he will not intervene, he will not stop the patient until the patient has finished everything. That's when he'll either now probe with some specific questions, and that has seen that has in a way reduced your consultation time,
yes.
And also making it easy for you to be able to probe the right questions.
Yeah, that's my approach usually, and it seems it works. But I noticed that my approach is also a little bit more, how can I say, cautious.
Yes.
Okay.
Yes.
Both because I'm working usually in another environment, so in my place I have more possibility to have a web of specialists around me that I can send and I have to send because if I treat something that I cannot treat is a problem for me. So I'm more cautious for this, and also because they are not patients that I will see in the future, and so I can't do too much, and then it's not my responsibility because I'm not here.
I see.
So my approach is also a little bit more cautious because I can't follow them. in the next days.
Yes.
So what happens if they are not good and it's my fault and I'm not here?
Understood.
Okay,
Yes.
so it's yeah.
It's a balance act.
Yeah,
Wow.
and also trying to make them talk more without me stop them. Sometimes, as you see with the patient with the problem of the legs and the bladder, sometimes they told you something that before never come out.
Yes.
So sometimes I like this approach because they tell you more. Also, if you doesn't want and you didn't think about you, they tell you to.
And also the fact that the other thing that I also noted is with this approach of yours is that even even after now you have talked to the patient, you've done your treatment, you've explained to the patient the treatment, you've done the treatment. Sometimes it may be very short, like it may be very, very short, and in a setting up like here in Africa, somebody may be like, oh, I've not been treated. But I've seen how you are able then to reassure the patient, look, what you have done is enough for your problem at the moment. We need to wait and see what happens in the coming days. I think that that's an approach that I've really admired. And if there's anything I've stolen, that one I've taken. That one I've taken.
Could you allow me to just ask one question?
Sure.
What happens if, like, a patient gives the wrong symptoms or doesn't give full information? Like, how do you go ahead with the treatment? And have you found yourself in a situation maybe you've treated the wrong areas and it has made the patient worse, maybe, or?
Why so difficult question?
It's difficult? I'm curious.
No,
I'm curious.
I can answer easily. Depends.
Yeah. Okay.
That's my answer.
Huh?
That's
Sorry?
my answer. Depends.
Oh, depends. Depends on. Okay.
I think his answer is a good one. It depends. It depends with what the patient has told you, what you can see, what you can feel. Okay, and that's how then because we are trained to be able to assess patients who can talk and patients who cannot communicate. So with that knowledge and that training, we are able to use other tools. If a patient cannot communicate, you can use other examination. You can use feel to be able again to still end up in the right place.
Okay. Cool. We can close up the podcast. Finally.
Thank you so much, Dr. Luca Pella, for again also taking time to do a Q&A with me. Although we did not plan very well for it, they did. Thank you so much for taking your time. Thank you again for coming to Africa. Thank you for coming to Nairobi, and thank you for coming to the Human Garage. I'm only gonna request that this is not should not be the first and the last. This should just be the beginning to a home in Africa. And since you're not married, we give you an African girl.
Okay. That could be. We have to talk about.
We have to talk about.
I have some ideas about.
Okay. Fair enough. Only thing is that you may have to bring in some cows from Italy. And I don't know how we're gonna ship them, but we have to pay some dowry.
Okay, well, I can take the girl to Italy. It's easier.
Oh yeah.
Okay.
Okay.
Perfect.
Sounds good.
We have an arrangement then.
Yes.
Perfect. Thank you very much.
Thank you so much. Good.